Good morning, my name is Aubrey Martin, and I'm going to go ahead and present my informative speech on the direct correlation between poor oral hygiene and heart disease. Okay. Gingivitis, cavities, swollen or bleeding gums, infection, inflammation, tooth decay, and heart disease. Which of the following doesn't belong? Well, that's actually a trick question, because recent studies have shown that oral infections and mouth bacteria can increase your risk of inflammation and heart disease. Excluding heart disease, there are so many negative consequences to poor oral health. Most people are well aware of the after effects of neglect, but few people have a real comprehension of the severity that follows this decision. Bad breath is the first effect. Bad breath is a buildup of bacteria in your mouth that causes inflammation and gives off a noxious odor. Not only is bad breath our body's signal that there's an excessive amount of bacteria in our mouths, but it's also a deterrent to any type of love life. Dr. Steve Kerrigan from the Royal College of Surgeons explains that the mouth is one of the dirtiest places in our bodies, often holding up to 700 different types of bacteria at one time. Next is gingivitis. Gingivitis is also known as gum disease or periodontal disease, and it refers to bacterial growth in the mouth that causes gum inflammation and bleeding. As gingivitis progresses, debris get caught in the gums, and it actually makes it pull away from the teeth. Eventually, this process leads to damages on the teeth that are so severe that tooth loss occurs. And I actually have a photo of gingivitis for you. And as you see, you can see the puffiness, the swelling, the inflammation, eventually bleeding would occur. Next up is cavities. Cavities are actually the second most common health condition in the U.S. next to your average cold. The main causes of cavities are bacteria and a combination of bacteria and a high sugar or starch diet. Cavities form when bacteria and plaque and tartar convert sugar into acid. After enamel is worn down, acid reaches the next layer of teeth, and eventually the acid and bacteria work together, and they work their way into the tooth, into the pulp, and slowly creating a bigger and bigger hole. If you've ever had any type of dental issue, I'm sure you know that the discomfort and pain is not the only negative aspect of neglecting your teeth. It's also pricey, medical procedures often reaching thousands of dollars. Here's a terrifying statistic presented by the Center for Disease Control and Prevention. Actually, 80% of Americans are affected by some type of gum disease. 75% is directly related to poor oral health. And just to put that in perspective for you, I have a little chart right here. So as you see, the 20%, you're actually in the minority if you never suffer from gum disease in your lifetime. As if gum disease, bad breath, and cavities were incentive enough to practice good hygiene, there is now evidence connecting oral infection and cardiovascular diseases. A study done by the Scottish Health Survey analyzed an impressive 11,000 participants. Patients were asked whether they visited the dentist once every 6 months, every 1 to 2 years, rarely or never. They were then also asked about their toothbrushing habits. They brushed twice daily, once daily, or less than every day. So what researchers found was that actually 62% said that they went to the dentist every 6 months at least, and 71% said they brushed at least twice a day. However, after adjusting the data for cardiovascular risk factors such as obesity, smoking, or history of heart disease, researchers found that people who admitted to brushing their teeth less frequently had a 70% higher chance of developing heart disease. Now, it's an interesting theory, but how exactly is this happening? How could the two possibly be connected? Well, Bristol University began to investigate exactly what was taking place, and this is what they came up with. Bacteria is actually interacting with platelets by mimicking the pressure inside the blood vessels of the heart. They found the bacteria uses the platelets as a defense mechanism. So by clumping the platelets together, the bacteria is able to completely surround itself. This platelet armor shields the bacteria from attacking immune cells and also makes them less detectable to any type of antibiotics. So quite literally, the bacteria is plotting against you. I have another visualization. This puts more of a comical spin on it, but it's pretty clear. Pretty clearly depicts the war that's going on in your mouth. Oops, sorry, I just pressed the button. But as you can see, a little graphic. Right, and then Dr. Kesloff-Lischwang, author of Study of Periodontitis and Heart Disease, explains that it's easy to see your teeth and mouth as two separate forms of the body, but in reality, they're actually intimately linked. In fact, it's suspected that when the gums become inflamed, bacteria is able to leak directly into the bloodstream. This causes inflammation and extreme damage to the blood vessels. Then Professor John Kleinman explains that when sending a patient to have surgery for their heart or valves, any type of gum disease is treated first to reduce risk of a subsequent infection. So as you see, this is a theory that's been taken very seriously because it can affect your medical history directly. But in conclusion, the conscious decision to neglect taking proper care of your teeth doesn't only lead to issues within the mouth, but it can also lead to a potentially lethal disease. So please remember to brush twice daily, go to regulated dentist appointments, and after all of this information, you might even want to consider flossing. Thank you.